Well, welcome everybody. My name is Eric Gallion. I'm Associate Director for the Illinois Trucking Association. And before we go ahead and jump into our first speaker, I just wanted to take a few minutes here just to go over some housekeeping items before we begin. First and foremost, I definitely just want to say thank you to all of our speakers who joined us on very short notice and who were all able to get together for a practice run through this morning so that we knew how everything was going to work and we could get smoothly through this. I want to offer a special thank you on top of that to Dan Meyer from FMCSA, who over the past 2 weeks has not only been great about keeping in communication with the ITA and letting us know exactly what's going on when it's happening, but also we've been putting him to work in a lot of these webinars. I think this is the third or fourth one he's done for us. So Dan, special thank you to you. Also, I'd be remiss if I didn't say thank you to Steve, Hal, and everybody over at the team at IANA for putting this together and partnering with the Illinois Trucking Association on this. It just wouldn't have happened without your help, and I know you all put a lot of work into it, and I appreciate that. And then for everybody that's listening, I want to let you all know that during the duration of the COVID-19 crisis in the United States, the Illinois Trucking Association will be publishing the latest information from all state and federal sources. If you would like to be a part of that, it's a daily email blast that goes out. You can send me an email, iltrucking.org. And an archive of all this information is going to be available on our website, which is iltrucking.org, and you can click the red banner at the top. And with that, Hal, I'm going to turn it over to you for a few words before we go into our first speaker.
We've got a great lineup today, a lot of information to share, so I'm just going to go ahead and jump right in, and I'm going to turn it over to our first panelist, and that's going to be Terry Stone from Oliver Wyman, and then Adrian Bailey is going to come in and close out that first section. So without further ado, I'm going to kick it over to Terry.
Thank you, Eric. Thank you for having me. With the time I have, I'm going to hopefully try and connect some dots together on the coronavirus overall and possibly dispel some myths and help people understand a bit more about where are we with regard to this virus and what can people be probably expecting in the coming weeks has been what we have found that we have been most useful at advising clients on. By way of context, I lead our health and life sciences business at Oliver Wyman. I myself am not a clinician, but I have an infectious disease doctor on the team. We've done work for the CDC. What I hope to do for all of you is help translate there's facts all over the place, how to translate some of this for a business person as to what does it mean. So let's start with just some of the basic facts, again, in the spirit of dispelling myths, because I think there's a lot of debate when I talk to business owners or business people today about how long are we in this for? People have their schools closed for 2 weeks and people are like, are we in a 2-week lockdown and are we done? A couple things people should know. You can read faster than I can probably speak, but the challenge with this virus is that it infects faster, okay? So you on average, okay, infect twice as many people as you do with the flu, all right? So the number of people basically that wind up picking up the disease if they're in close contact with someone who's infected is double, all right? The real problem we all have, again, we haven't had a lot of viruses jump from animals to people that hit the U.S. at large scale. Other things in the past, H1N1, other things had been contained a bit more. Things like MERS wound up staying in the Middle East. So we, especially here in the United States, don't have as much experience in dealing with the spread of viruses like this. But what we don't have is herd immunity. And herd immunity is when the virus is part of, like when the flu, we all have herd immunity to. Not everybody gets a flu vaccine, yet we still manage to not disproportionately infect 80% of the population. When a virus jumps from an animal to people, human beings just don't have some of that immunity, and that's part of what drives it to flip through the population faster. Related to that, it's that the incubation period is longer, okay? I know you see lots of different data points on here. It can be up to 14 days. The median point's probably about 5.5, but again, it's longer than the flu, all right? So what's happening is we're touching more people. The period of contagion is longer. As you look below this, also people who are asymptomatic can spread it. And as many people have heard, the fatality rates are substantially higher. And relative to the flu, the percent of people who wind up severe, so you need to be in the hospital or on a respirator in the ICU, is much greater. These are all the reasons why this becomes a much bigger deal for us than other things, or when people try and dismiss it as the same as the flu. And I'll explain what the implications are in a moment. Okay. So the other thing people often say is, who's right, China or like the UK? Can this be contained, or is it going to kill millions of people? And the truth of the matter is both are sort of right. China, South Korea, lots of some other countries have contained it. You can see in the curves here, they get up to a point and they're able to clamp down. Other countries, the rate of infection is escalating at a much higher level. And I'll explain why that will be on the next slide. But I want people to realize that it can be contained, but it really depends on what you do. When you think about COVID-19 and you compare it also to these other diseases, I also want to just put it here against things like the flu, H1N1, SARS, and measles. Measles is problematic because it can be transmitted much more readily. But when you compare COVID-19 against things like H1N1 or the flu, it definitely is much more problematic because the amount of time that you stay out there infected and how you spread it. Okay. The virus is stronger. There are a number of things that contribute to that. But these are reasons why we have to control how fast it spreads. I'm sure by this point, everyone on this call has probably heard the concept, flatten the curve, or this idea of social distancing and why we need it. The problem you have with a virus that's that contagious and that hardy, which we don't have immunity to, we have no vaccines yet. It will take at least a year because you have to grow vaccines. You can't just manufacture them on a manufacturing line. We neither have one that works yet, and it takes a while to ramp it up because you need millions and millions of vaccines in order to create some immunity. What happens then is the only thing we actually really have at our disposal is preventing it spreading by keeping people away from each other. It's why Illinois went to shelter at home. It's why you see across the country people closing schools and closing restaurants, et cetera, because this is truly the one way that you can slow it down. And the reason we need to slow it down, and I want to be very clear about this, the reason we need to slow it down is not that every one of our employees or every one of our children will catch it, because over time, in the course of a year or so, it's quite likely without a vaccine that many of us will catch this. Many of us it will feel like a mild flu. For others, they could get definitely more sick, right? But the problem we have is the speed causes spikes or surges in the cases. And that's what this chart shows. The reason we're doing all this shelter at home and social distancing is the healthcare system does not have enough ICU beds or enough respirators to be able to absorb all of the potential people, because 20% of people wind up with a more severe case. The healthcare system and our capacity is not adequate to cover that. So what you want to do is not have a tall, spiky blue curve where the system gets overwhelmed. All right, that's what's happening in Italy right now. That's what you see when you're finding that in Italy, you're hearing stories of how doctors are having to decide between whether they take somebody off a ventilator and give it to someone else because they conclude, well, that person's been on a ventilator a few days. I'm not sure they're going to make it through, and I need to give it to this 30-something. And that's a really tough spot to be in. And when the system gets overloaded, not only do we have problems with COVID patients, but people in America still will have heart attacks or other problems or accidents. And so the main thing we're trying to do with shutdown now is to get the curve stretched out and looking more like the green line below, because that way we know we're going to infect lots of people, but we can absorb it into the system in a manageable way. Again, by way of contrast about can you control it or not, I showed a previous slide that showed China did. If you look on this page, you see China, and then you see to the middle, it's to the bottom of the stack of countries, that South Korea, the aqua blue line. Those are examples of countries that have actually managed to taper it off, okay? But I want to be very clear. What they did is very different. If you're going to roll in the military and you're going to basically shut down the entire province of Hubei, and you're going to shut down all the manufacturing, and you're going to monitor people on their mobile phones, where they are, so you know who they've had contact with, you wind up being able to contain it much more aggressively. South Korea not having the type of politics of China had to take a slightly different approach, but because they learned from SARS, in South Korea, they just had many, many more tests available. So very early on, they were testing massive swaths of the population, and they were forcing people to be tracked on mobile phones as to where they were going and what was going on, so they could ensure that people were quarantining. And by doing that, they were able to also, they had a steep outbreak, but they had been able to kind of taper it off. Okay. You see, in contrast, I think people have heard of what happened in Italy. But Italy did a lockdown, but they only did it in one region and it wasn't as robust. They still allowed travel in and out across the country. And what happened was Italy's small lockdown resulted in what we've seen over the last weeks, which is spiked really high up. And eventually they had to be one of the first countries to shut down substantially. We're starting to see the new cases there declining, which is good. But a lot of the other places like the UK, France, and the United States are in a very different stage of progress against that. And so I want to share that so people realize we are doing things, that this is where we are in a slope versus much more draconian measures that start to flatten it out. I think our time to flattening will be a bit longer. I will hit this quickly because I have more parts to cover, but this gives you a sense of market by market. New York is the most hit right now. But you can see like the different slopes of the lines that correlate to sort of the degree of intervention and when it occurred relative to, say, the 100th case. Pretty hard to perfectly track because of the issues with differences in testing and how many testing kits are available to confirm cases. But you can see that different parts of the U.S. are progressing at different states, and New York City is definitely in the thick of it. By last count, when I spoke to folks at the hospital systems there, they're estimating they're probably about 30 days to their ultimate surge, and they're already having some of the hospitals a bit overwhelmed in terms of the volume. I will hit this quickly. Case fatality is something that no matter, like depending on what article you read, you believe some people are overinflating it and other people are underinflating it. I simply want to say how people compare the numbers differs based on how many tests they did and what they're able to really track. Okay. So it's not surprising there's a range. Countries like Italy have a far older population, and it's not surprising that their case fatality rate is higher. The United States right now is trending at about 1.5. Those numbers could go up. The basic thing to realize is regardless, even if it's at 1.5, it's many times over more fatal than something like the regular flu, regardless of what people like to say on TV or in the news. There are actually therapeutics out there that are being tested, okay? I think people heard President Trump speak of malaria drugs. A number of drugs that are not FDA approved for these applications, but are out there. And, you know, very sophisticated healthcare systems like Partners Healthcare and Mass General, affiliated with Harvard Medical School, are trying them. We don't have enough that it's a solution writ large, and there's not full evidence at scale that it really could rein it in to fundamentally change the duration and time of this. But it is important to know that there could be, one of the things that could break through for us is a bit more on the therapeutic side. As I mentioned earlier, vaccines will come, hopefully, but they will still be a year out, possibly longer. And so it's just important to realize that when you hear people talking about how long will this be in effect. So the real question of how long this lasts, and we've been revising our own scenarios, but I'll distill it down quite simply. Our best estimates right now are definitely ranging more in the scenario 2 zone here. Okay, so the truth is we have not in the US cracked down hard enough that we believe that we'll be fully through this within 4 to 6 months from when it started, say, in late February, okay? That's about what you've seen in China so far, although they haven't fully opened up yet. So for all we know, they'll wind up in a scenario 2 as well. Assuming we don't get a breakthrough drug very quickly, we're probably trending more toward the 6 to 12 months from, say, back in February to fully rein this in. That does not mean we'll necessarily all be locked down in our homes for 6 to 12 months. As consumers, while you guys are out there making sure the supply chains run. But what it does mean is that we are still probably talking about a couple of months whereby we might need very extreme social distancing from where we are now. And that in the months after that, there will likely be flash outbreaks that occur where we'll have to do more localized containment to avoid things spreading back out. Okay, so when I say New York's about 30 days out from the peak in their surge, they still have to get down the backside. And then many other geographies in the US are probably 2 to 4 weeks behind that. So that's why I tend to factor in you're likely a few months before we're massively opening up things like restaurants or other enterprises. You want to go, I know I'm hitting at my peak, and I know Adrian wants to highlight something. I think you can skip 2 pages forward.
Thanks, Terry. And I'll just tell everybody on the Oliver Wyman website, there's a COVID hub, and all of the stuff Terry's talked about, plus more information, is sitting there. I know the speakers today are going to hit some of these items, but we just want to talk briefly about 3 areas that very concerned about in the supply chain. If we're all going to have these kinds of situations in front of us for 4, 6, maybe even longer number of months, what we absolutely have to do after we take care of our healthcare providers and our first responders is take care of the transportation system and keep the supply chain fluid. There's already signs cropping up around congestion that is happening at ports, equipment imbalances. We need, as an industry, to come together, and we may need even more drastic measures downstream in order to ensure that we're keeping the supply chain fluid. And that means we can't have containers on chassis sitting, in various places, not allowing those chassis to continue to keep the freight moving and the facilities fluid. The second is we really need a national standard for essential functions. Like every state and municipality right now is having to define their own version of what's an essential function. And the supply chain is complicated and somewhat not in the forefront of everybody's mind about all the parts and pieces that are necessary to keep it moving. And I think as an industry, we need to think about how we can assist our country in establishing a standard that everybody can adopt when they're thinking through how to allow movement within their territories as this disease progresses. And the last is we've got to protect the people working in the supply chain. There's some serious situations that are developing minute by minute that none of us have ever encountered before, and we're having to devise protocols and establish procedures to help companies and the employees continue to be able to have confidence to go out and do their work. And I think this is something that as an industry we need to come together on and make sure that we're sharing best practices and helping, and even through on the enforcement side, for people to understand that we've got to give our employees the confidence that if something does happen, that the outcome for them is going to be such that they are willing to kind of continue to put themselves into the fray and come to work to help keep the freight moving. So interested in all the comments from the next speakers, and also all of you on the phone. I'm sure I know many of you interested in your thoughts. You can always reach out to me directly. And Hal, we'll turn it back over to you. Thank you so much for including us in this session.
Great. Thanks, Terry and Adrian. Really appreciate it. Alan Karakaroff from the American Trucking Association to give us kind of a look at the potential economic impacts of what's going on. So, Alan?
All right, great. Thanks, Hal. So there's no slides. Just let me put that out there right away. I don't have any slides going into this. I think a lot of them would become outdated within just a couple days here. So I'm going to touch on some of the macroeconomic trends we're seeing in the U.S., some of the impacts on the domestic and international supply chains, and some news specific to the trucking industry around COVID-19. So before hitting on some of the major indicators that have been released, it's important to note that there's a significant lag between what we're seeing in the data and what we know. So a lot of this data is going to be for February or maybe earlier, and that's before we're starting to see the impacts of COVID-19. We do have a couple that are more up to date. One that we've seen in the headlines a lot today if you turn on the news. But there's a lot to cover in just 10 or so minutes. So I'm going to keep it at 10,000 feet, but welcome any questions at the end. So in general, as a big overview, as you'd expect when shutting down a lot of these consumer-facing businesses, you're seeing travel and tourism being decimated. You're seeing small businesses, especially restaurants, being hit the hardest, and it's likely to get worse before it gets better. Most of the forecasting that's going on is mostly in the dark, just because of this lag between what the data says and what we see day to day. So I'm going to give you a little bit of insight going forward, but I'm not going to get too into the weeds there. So one big sector that we look at ATA is the retail sector. So we saw a little bit of weakness in February from January, strong compared to a year earlier, but we already did see a little bit of weakness going into the impacts of COVID-19. What we're seeing now, we're seeing very strong freight volumes, especially among consumer staples, especially grocery items. But there are some weaker areas, particularly your big ticket items like autos, and a lot of weakness in clothing also. Also in the retail sector, we're expecting online sales to be solid for the next several weeks, especially compared to your brick and mortar stores that are going to struggle. In the housing sector, we've seen a very strong housing sector going into March. So housing starts in February were strong. We're up year over year as they have been the last 3 or so months. January actually saw the highest annualized rate that we've seen since December 2006 at 1.62 million housing starts. We're also seeing very strong new home sales. January's new home sales annual rate was up at 800,000, which is the highest we've seen since May 2007. So really strong start in in the housing sector, but we're expected that to fall as we get through the year. For a couple of big reasons here. So one, households are going to become less mobile. Household formation is falling, and we're going to see some negative income effects as we see some income losses here as a result of COVID-19. Another big sector we look at is manufacturing. So manufacturing was in a recession going into some of the impacts of COVID-19. With manufacturing, we do have some indicators that are already showing the impacts. But in February, we actually saw a little bit of moderate strength, evidenced by industrial production index edged up about 0.1% from January. ISM reading was just above 50, indicating expansion at 50.1. And we saw durable goods orders come in this morning, increasing on a month-to-month basis at 1.2% in February from January, which is the fourth increase in the last 5 months. So pretty moderate manufacturing. It's holding up a lot better than your services sector or your retail sector, but don't expect that to last too much longer. For one, these February measures you saw pretty moderate growth just because of a big increase in motor vehicle parts as GM was replacing some of the inventory they lost from their strikes late last year. But going forward, as I mentioned, expect manufacturing to struggle. Right now, we're just seeing a lag, but expect to see two big headwinds come forward. So one is the supply chain delays that are going to limit output. So that's your supply side headwind. But then they're also going to see a demand side headwind as there's a big cutback in demand for goods, especially your big ticket items like autos and auto parts. So a couple of big indicators that came out that are already showing the impacts on the manufacturing sector. One is from the Philly Fed report for March, showed their manufacturing index fell to the lowest level they've seen since 2012. And then on top of that, we saw a PMI measure, a Purchasing Manager Index from IHS Markit, declined to 49.2 from 50.7. That's the lowest we've seen since the mid-2009s, and anything below 50 is a contraction, so 49.2 there in the manufacturing part of that. Finally, I'm going to get to this job market. So big headline number that came out this morning's estimate, jobless claims jumped from 281,000 last week to 3.3 million for the week ending March 21st. So that came out this morning. This is unprecedented, absolute skyrocket. If you've seen any of the charts, the old record we saw was at 695,000 in October 1982. Even in the Great Recession, the peak was 665,000 in March of 2009. So this jump to 3.3 million is really unprecedented there. And really it's just the start. Reality is much higher. Think of that as a lower bound. So a lot of people who don't qualify for unemployment benefits are your self-employed, gig workers, independent contractors, many part-time workers or recent hires aren't going to qualify for that. So when you're thinking about overall employment or the unemployment rate, February we saw it at a 50-year low of 3.5%, but going forward we expect that to surge to more than 10% in the coming months. Another overall picture of the economy, really we're looking at a recession is not avoidable at this point. It's just a matter of how long it lasts and how deep it is. Right now, we expect quarter one to come in with a little bit of growth just because of January and February. March seems to have taken a bit of a turn here. But quarter two is really where the ugliness is, expecting that to be down 10 to 15%, even some estimates more than that. So quarter two is really where the brunt of this is going to be focused. We have seen some government action, government stimulus packages. Phases 1 and 2 got passed. We saw phase 3 final vote come through 96-0. It approved a $2 trillion emergency package last night. I'm not going to go into too much of the details with that. ATA does have a landing page on COVID-19 that has a lot more information. I'll talk a little bit about the domestic and international supply chains. So the northern and southern borders closed Saturday, early Saturday morning, 12:01 a.m. to tourism. There's a lot of rumors going around about that, but it is still open to all freight, all trucks, all drivers. Even if you're just driving to work, drivers in personal cars or walking across the borders are able to get through. Drivers don't need their passports. All they need is their fast cards, et cetera, whatever they usually use to get across the border. We're seeing China imports coming in very slowly, so that's going to hurt your drayage activity. Factories in China are between 50 and 90% back up to capacity. It depends on the factory and the location. We're seeing some empty containers that weren't initially sent back to China. They're working their way back now, expecting to hit our West Coast ports in about a month and our East Coast ports in 1 to 2 months. A little bit longer delay there with the East Coast ports, just because of how far Europe is in this pandemic. But eventually expect those port volumes to spike. Now, looking more specifically at industry trends, so companies are hauling a lot of consumer staples right now. As I mentioned before when I was mentioning retail sales, it's really the storm before the calm right now. So right now we're seeing volumes like a solid peak season. It's almost the best we've ever seen. Food, cleaning supplies, medical-related products, bean industry is doing especially well. So a lot of consumer staples are doing great here. You might see this before a hurricane, but this is at a nationwide level right now. But don't expect this to last. There's going to be a payback period. You're going to see freight slow significantly. Don't be fooled by how strong this freight is right now. The pace just cannot keep up. You heard me mention the jobless claim number, 3.3 million jobless claims. So even if these are temporary losses, these are going to have a big impact on demand for goods. You're also seeing auto factories shutting down for longer than previously announced, and that's going to further hurt freight volumes. You'll see some beneficiaries here. You're seeing grocery stores doing a lot better than restaurants now, and you're going to see a boom in online sales. February tonnage we released on Tuesday was actually up 1.8% after falling 0.3% in January. Year over year, it was up 2.6%. So this positive growth here was largely because of solid housing starts, high level of retail sales, and modest improvement in manufacturing helping those freight volumes. But still, we're early in the COVID-19 emergency, so we're seeing positive volumes now for consumer staples, but as this shutdown continues, the economy is going to contract, and it's going to hurt volumes considerably in the second quarter. Expect a high number of motor carrier failures once this surge demand ends. We were thinking a high number of failures before COVID-19, with quarter 2 being the transition quarter to better freight and tighter capacity, but now expecting the purge to be largely in the second quarter. There's much tighter capacity on the back end, kind of like 2018, but that's going to depend on how strong the economy grows after this is over. A few more things here. So impact on OEMs is going to be significant. We're already thinking Class A truck sales were going to be down 30%, trailer sales down 20%. Now we're thinking more closer to down 50%, and trailers about the same as well. Assuming a huge number of failures are going to hurt the Class 8 used truck prices as well. We are seeing some positives here. So from ATRI, we're seeing that transit times have increased because of a reduction in traffic, especially during rush hour, and as carriers are running 24/7 operations, so higher average truck speeds across most hours of the day. Truckingresearch.org has more on that. And then just a couple more things here. So ATA and truck stops are working to avoid a diesel shortage. There's a significant amount of winter grade gasoline remaining in tanks, terminals, and pipelines, and there's an inability to sell it after May 1st, 2020, which is the transition date. Terminal operators are going to have limited capacity to take loads of summer-grade gasoline, but ATA is sending letters to EPA trying to get a waiver of summer gasoline sale requirements to avoid this diesel shortage. And then finally, we're seeing statewide restrictions on travel and business. You've seen all the headlines in the news reports. ATA has more updated information on that. And then finally, I'm just going to close it off with that we're hearing that most drivers are continuing to show up to work, which is great. They're nervous about it, but they are continuing to show up and really making sure this high demand is met. And with that, I'll end it and pass it back to Hal.
Thank you so much, Alan. That was great. A lot of great information. Moving right along, I want to turn it over to our friend Dan Meyer at FMCSA to give us a quick look at what's happening in the regulatory environment, how that might be affecting us. Dan?
Thank you, Hal. First of all, I want to say thank you to the industry. We are in unprecedented times right now, and we would be in far worse situation if it weren't the way the industry is stepping up and helping everyone out with the current situation. Here at FMCSA, we're trying to do our part. We're trying to introduce regulation or reduction in regulations to allow them to move the products they need to move. To that end, we've issued an emergency declaration following the presidential order, if you go back, on March 13th. After hearing concerns from the industry, we did expand that declaration on the 18th. We've changed our link. If you've been using an old link, it'll still work, but we now have a new link, fmcsa.dot.gov/COVID-19. This is going to be our homepage for all information that we are posting related to COVID-19 and relief that we're bringing forward through our waivers. Our current emergency declaration does contain, our page contains FAQs to address some of the industry questions we received. The first batch of FAQs were released on the 19th, and we just released a follow-up set of FAQs yesterday, late last night. The transportation for the emergency declaration must be in direct support of the relief efforts related to the COVID-19 outbreaks. A list is on our emergency declaration, but the primary takeaway for this, particularly when we're talking about restocking grocery stores, is mixed loads may be restricted, but not if you're restocking the shelves. That's not what we're trying to restrict. What we don't want to see is a case of water thrown on a load of televisions. Televisions wouldn't be included in this, but the restocking of the grocery store shelves would be. The way you want to think of this is restocking versus replenishing. You know, we want to be out there keeping those shelves full. The current declaration is set to expire on the 12th unless an extension is still needed. Of course, it'll be evaluated and released well in ahead of the 12th so that everybody can understand what is needed to be done out there. Next thing we released was ODAPSI released guidance on drug and alcohol testing, the Office of Drug and Alcohol Policy Compliance Controls Part 40. And so they provided some guidance, and the guidance they provide is for all drug testing across the board. It includes FAA and other regulatory entities that they have control over. So to follow up with that, on the 23rd, we released drug testing guidelines related to the FMCSA specific. Particularly hit is the random testing. Right now, some facilities that do random testing are not admitting new patients or allowing new patients in. Some facilities have converted to COVID-19 facilities, so they won't allow anybody to come in. If you're encountering those, part of this guidance is that for your random testing rate, if you can't meet it for this quarter, just spread it out for the remainder of the year. As long as you have met your testing percentages for the year, we're not going to consider enforcement action because it wasn't met for this particular quarter. If you are having issues with post-accident testing or reasonable suspicion testing, and you followed your policy for looking for alternate facilities and still cannot meet it, document, document, document. That's going to be the key word in this situation, is document why you couldn't conduct the testing, particularly in the post-accident testing as required in 382-303. You want to follow along and document that. The Drug and alcohol testing relief is limited, and we cannot relieve the pre-employment testing. So when you see that in the guidelines, you'll understand where that's coming from, because ODAPSES did not allow that to occur. Regarding the CDL and medical certification issues, we issued guidance providing relief to the state agencies. This allowed them, because a lot of the state agencies have closed or are not letting the public in for normal course of business. And so with that, we've provided relief to the state agencies and told them we will not hold them accountable if they can't meet testing guidelines or they can't meet the timeliness. We followed that up with a notice of enforcement policy relief from our regulations for CLP holders, CDL holders, and non-CDL drivers. We're not going to enforce somebody whose license expires during this time that we're dealing with this issue, but the license must have been valid on February 29th, and the expiration must have occurred after March 1st. This does not impact planned safety suspensions or revocations. If somebody is going to go through a safety suspension for safety reasons, that will still go into effect. This enforcement policy provides relief for any actions that occurred through June 30th. We followed this up with our next document, which was a waiver, where we actually waived for the state's CDL holders and CLP holders and interstate drivers, providing complete relief if they're unable to renew or unable to provide medical certification status to the SDLA. Some SDLAs, such as Illinois, are still trying to record medical document or medical certifications on a driver's record, but there again, drivers are running into situations where they cannot renew their medical card because the medical facility is either closed or not accepting non-COVID-19 patients. So in that situation, if you can't, try to find an alternate medical facility to do the testing. If you absolutely cannot find a place, then this provides you the relief from that. Now, one caveat to this is, in the waiver, each motor carrier is required to notify FMCSA within 5 business days of any federally reportable accident involving any driver operating under this waiver. Now, this waiver does expire June 30th of 2020 unless extended. And now I will say, this is one of the most complicated waivers. There are a lot of issues in there. So I strongly recommend anybody who's intending to use this waiver, please read it in its entirety and thoroughly so that you have an understanding of what the allowances and the requirements are. Because one particular issue is you must have had a medical card prior to or February 29th or prior. It must not have expired, because we're not going to allow medical card. Anybody who's operating with a less than 90-day medical card cannot partake in this. So you must have had a medical card. It must not have expired. It must be expiring after March 1st. So there are restrictions. Pay attention to that document in its entirety if you intend to use that waiver. Our website also has additional guidance from our sister agencies and other areas of concern for the industry. A lot of you operate with TWIC cards, and so the TSA enrollment services are still out there and still operating. We have posted a link to that guidance document on our website that can be referenced. It provides some FAQs from TSA for you to look at on your TWIC cards or your emergency cards. FMCSA, the Pipeline Hazardous Materials Safety Agency, has provided some enforcement discretion to HM employers who are unable to provide recurrent HM training, meet the recurrent training requirements. Now, they do advise there are other options for this training, and they encourage you to use those. But if you cannot get the recurrent training completed, they are providing some discretion. The other issue is we are providing enforcement discretion and options for temporary operating authority for any private carrier that wishes to haul for hire during this time frame. That is available through our website. We've got information on how a private carrier can apply for a no-fee operating authority to operate under the emergency declaration. If they want to continue with the operating authority at the end of the emergency, they will have to pay the appropriate fee to maintain that operating authority. They still have to have the proper filings and proper documents on file with us, but we are expediting those options so that we can get everybody's operating authority needed. Lastly, our future actions going forward, we are continuing to monitor the industry's concerns and issues. We are monitoring rest area and truck stop closures that may be occurring across the states. We don't have jurisdiction, but we can reach out to those respective states or organizations to try to avoid any impact to those trucks that are remaining on the road. If you are finding areas of concerns with drivers being stopped and ask for papers or documentation of being essential, please let us know, because there's no requirement for you to carry our waiver document with us. I will inform you that some states, if you're going to use their weight waiver, Illinois is one, and you're going to use their weight waiver, you must carry that document with you, but that's only if you're going to operate overweight subject to their waiver. If you are operating wholly within our emergency declaration, it is not required to be carried. The other issue is we want to know about any localities that may be imposing quarantine or curfew orders or any other challenges the industry is experiencing with truck stops, fuel centers. Report them to your local FMCSA division office. I can tell you that we are having daily calls to discuss issues within our state. We're reporting to our service centers, who are then tracking those to the headquarters. We are tracking this information. We're doing everything we can to keep the trucks on the road, to keep the supply chain moving, because we recognize it is needed. If you have any issues or questions regarding our emergency declarations, we do have an email set up for this. It is indicated there on the slide deck, FMCSA declaration at dot.gov. It is monitored, and we are tracking the information as it comes in. I'll turn it over to the next speaker and take questions at the end. Thank you.
Thank you, Dan. I really appreciate it. We're going to transition into the enforcement side of things with Colin Mooney from CVSA. Colin?
Good afternoon, everyone. It's a pleasure to be here to provide you an update on what we're doing roadside from the Commercial Vehicle Safety Alliance perspective. First, thank you, Dan, for providing a recap on all the activities that FMCSA has released over the past few days. Very, very much needed in this time of need. Ever since FMCSA and the President issued their national emergency declaration on Friday, March the 13th, we kicked into high gear in coordinating all of our activities with various trade associations and public sector associations. So working closely with the folks at IANA, ATA, UIIA, and any other major trucking association to make sure that we are communicating widely and have open lines of communication. However, the one thing that hit us hard last week was all things CMV credentialing related. So immediately, right around the middle of last week, FMCSA and CVSA, as well as all the public sector associations such as AMVA, who's the DMV association, IRP, IFTA, UCR, and even north of the border with CCMTA, we immediately saw a need to coordinate activities because of all of the respective government agencies shutting down or closing or transitioning to online operations. So for the past 10 days, we've been collectively getting everybody in line to obviously to provide emergency declarations, waivers, extensions of credentialing, and FMCSA was one of the first out of the gate with releasing all of their information here earlier this week. And you'll notice a theme in those documents where the grace period is from March 1st through June the 30th, and that is by design. We are actively working with all of the other credentialing organizations that have authority over those credentials within the state. As waivers and emergency declarations are coming up for renewal, because right now we've seen a patchwork of documents. Some are 30 days, 60 days, 90 days, or some undefined. And as those are starting to renew, we are trying to align all of our activities for everybody to pick a point in time, such as June 30th, to allow all of us, not only on the government and enforcement side, but also you as the industry, enough time to breathe, so we can just hit the pause button, see what's happening within our industry, see if June 30th may not even be the right date. It may need to be the end of July or the end of August. So that is an activity that we have been having daily phone calls with all of the relevant authorities to try and align all of our efforts. We find that once we get to the other side of this issue, we are going to have quite the mess to untangle. So we are trying to do the best we can on the front end to allow everybody to keep working, to keep the supply chain open, and we will deal with the credentialing issue mess at the back end. So there's more to come on that front as we start to align all of our various credentials. If anybody is interested on the relevant association websites, whether it's IRP, IFTA, UCR, CCMTA for all the Canadian DMV authorities, and also AMVA for all of the DMV consolidated documents that they have. If you were to go to their individual web pages, right on their home pages, they have PDFs and documents, so you don't have to go to each state to find all of this information. They're trying to represent their constituents and their membership and make sure that all that information is consolidated in one place for you, not only for the enforcement community, but also for industry as well. So one of the other things that you've seen over the past few days is we've started to wind down a lot of our enforcement activities. And even though some of the jurisdictions are still conducting commercial motor vehicle inspections or size of weight enforcement, they're really trying to limit their interaction with individual drivers. We must be aware that this is not a regulatory free-for-all right now. So it's not the impression we want to give. Right now, in situations like this, it's ripe for fraud and abuse. So we are actively trying to see what's happening and transpiring within the industry and trying to make sure that we have a physical presence on our highways. So what you've seen or may have seen is the CMV enforcement community is pivoting a little bit. So you're going to see a lot more of patrolling of truck stops, distribution centers, anywhere where there's high truck traffic. We realize that cargo theft is always a big issue that we're concerned with. However, in times of need like this, we could see a spike in cargo theft. So we feel that having a physical presence and patrolling all of those centers is actually going to provide a deterrent effect as opposed to stopping, inspecting, and interacting with people. So you'll see that if you haven't already over the last few days. A couple other things that we have done over this past week, we held 2 webinars. There was an Inspector's Guide to Infectious Substances and COVID-19. We held that on Monday for the enforcement community that was very well attended, where we outlined all the safety precautions that you need to take when you're stopping and interacting with the public. And then we also went into the hazmat regulations, outlining the Class 6.2 infectious substances requirements and the Category B requirements on packaging and labeling and shipping for all of those test samples that are going from the patient to the test facilities. And then also outlining the requirements when we have this large volume of hospital waste that is going to flood the system on the other end. One of the things that was concerning as of yesterday is we received a couple calls from some of our compressed gas motor carriers expressing concern that the cylinders that they're picking up at hospital and medical facilities have not necessarily been decontaminated. So we immediately sent out a notification to all of our enforcement personnel to steer clear of all of those Class 2 compressed gases that are on the road. It's definitely not ideal. We've been in contact with all of those companies to ensure that their drivers are equipped with spray bottles for disinfectant. So even though they may be disinfected at the hospital moving forward, there was a period of time that some were not. And moving forward, we can't guarantee that all of those cylinders would be disinfected appropriately at the hospital. So we're steering clear of stopping and inspecting anything cylinder related for the time being, because we don't want to be spreading the virus and the disease. Yesterday, on Wednesday of this week, we also did a similar webinar for the trucking industry and their guide to infectious substances and COVID-19 as well. That was also very, very well attended. Based on the attendance of both of those webinars. We plan on holding probably more in the very near future as we learn more and what needs to happen. Some of the other enforcement activities that we have stopped is you probably noticed that we've postponed our international road check that was scheduled for the first week in May. We have not selected dates at this time. We're electing to punt until later in the year because there may not be a time that's appropriate to conduct international road check this year. So we didn't want to be tied to another set of dates that we would have to then either postpone or cancel at that time. We've been in active communication with FMCSA and all of our members in the field. We've had weekly conference calls with all of them to see what they're doing and how they're working. And like I said, there's very little enforcement happening at the moment, as opposed to just making sure that there's a physical presence on the road, because we want to make sure that everybody's safe on the road and that that everybody's taken care of. So that's what I have today on what's happening on the enforcement side. The biggest thing keeping us busy right now is making sure that we get all of these credentialing issues wrapped up, and that's everything from driver, vehicle, motor carrier related credentialing. So that's what we've been working on.
Colin, thanks so much. I really appreciate it. And I think on behalf of everybody on the call, we'd really like to extend a special thank you to all of your members who are out there doing that great work on the roads, keeping the roadways safe, protecting us all out there. So up next, we are going to hear from my colleague, Debbie Sasko from IANA's Information Services that administers the UIIA, who's going to talk about detention, demurrage, and all sorts of other good stuff that's probably keeping some of you up at night. So without further ado, I'm going to turn it over to Debbie.
Thank you, everyone. Good afternoon. I oversee IANA's information service programs, the day-to-day operations of those services, and the UIIA program is one of those programs that is the standard interchange contract between the motor carriers and the providers of equipment, steamship lines, rails, and leasing companies. And what I want to go over with you today is just some information should you have issues with detention or per diem billings that you may receive where these current conditions may have impacted your ability to pick up or return equipment. We've gotten some questions from a few motor carriers already in regards to the force majeure provision that's in the UIIA, which there is a provision in the UIIA for covering these types of situations. But the applicability of that force majeure provision will be based on the specific facility location, because it may vary by geographic region, it may vary by state. And so if it will depend on the conditions that are present at that specific facility you're at, the specific EP you're dealing with, and whether those actual conditions precluded your ability to return or pick up that equipment. So certainly if you feel that is the case when you receive an invoice, you should then dispute that with the individual EP, indicating that you believe force majeure should come into play in regards to the charges that you're receiving. The first step you want to do in regards to an invoice, if you get something that you feel you should not have been billed for in regards to per diem, would be to dispute that with the individual equipment provider. And you should have access to all the equipment provider addenda through your UIIA account. So you want to make sure that you check that the specific provider's addenda to see if they have their own dispute resolution process within their actual UIIA addendum. If they do, that would be the process you would follow. In absence of that information within a provider's addenda, then you would go to the default dispute resolution process that's in the agreement under Section H1. And that default process allows you 30 days from the date of receipt of the invoice to dispute it with the equipment provider. So you want to make sure that you check to make sure whether there is a process within the provider's addenda or if you need to use the default process. That's the first thing you want to check. Once you dispute the charges with the individual provider, and if there's no resolution to that, then the agreement also affords signatories the ability to submit a claim for binding arbitration. There's a binding arbitration process under the UIIA, and the criteria and the guidelines for that process are in Exhibit D of the agreement. So if once you dispute it and the EP responds to your dispute and there's no resolution, then your next option would be, if you elect to do so, is to file it for binding arbitration. The binding arbitration process, there's the types of charges that you can submit a claim for include per diem and detention, maintenance and repair, and equipment use rental charges. Currently, storage charges are not an acceptable type of charge to submit a binding arbitration claim for, so you would need to deal directly with the equipment provider on storage charges. When you're getting ready to make a decision whether to submit a claim for arbitration, you want to make sure that the invoice that you're dealing with involves a UIA participant. And many times it might be for, if it's for, like, for example, chassis rental charges, and it may be for a non-UIA signatory, such as TRAC or DCLI or FlexiVan. Those chassis providers not currently participants in the UIIA. So if those charges are being billed directly from those entities, you would need to deal with them in regards to any disputes, and that would be covered under your direct agreement with those companies. However, if the UIA equipment provider, say an ocean carrier, is providing that chassis as part of the container move, then certainly you would be able to submit it under the arbitration process. There are established timeframes you need to keep in mind when you're going to submit a claim for arbitration. The process has two parties. There's a moving party, which is the party that has been invoiced, and then the responding party, which is the invoicing party. The majority of the time, the motor carrier is the moving party, and the equipment provider is the responding party. So once you initially dispute those charges, as I talked about in the earlier slide, and the EP comes back to you and declines that dispute and says they believe the charges are valid, then you would have 15 calendar days from that date to make a determination whether you want to submit that claim for binding arbitration. Even though there may be ongoing communication between you and the equipment provider, once that provider indicates that they believe those charges are valid, that's when that 15-day clock starts. So if you're thinking or anticipating you believe you want to submit it for arbitration, you want to keep in mind that 15-day clock to submit the claim. Once we get a claim for binding arbitration from the moving party, we take a look at it, make sure it meets the criteria, and then it would then be put together and sent to the invoicing party for comment. They have 15 days to provide any types of comment they have in regards to the claim and any type of supporting documentation they wish to submit in regards to the billing that they've submitted and why they believe it's valid. The arbitration panel gets the claim after those comments have been submitted by the responding party. We put the whole claim together, and then we send it to the arbitration panel. Arbitration panel members are comprised of representatives on the Intermodal Interchange Executive Committee, which is the group of industry representatives that oversee the administration of the UIIA. Panels consist of a ocean, motor, and rail member. So depending on what mode is involved in the claim, say it's a motor carrier and an ocean carrier, it would go to a motor and ocean arbitration panel team for review. If that particular modal group panel cannot reach a consensus on the decision, then we do have a senior arbitration panel that is consisting of a motor, ocean, and rail panel member that are the longest tenured IIC representatives, and they would then review the claim and make the final determination in regards to the decision and the responsible party. The arbitration panel has 45 days from the date they receive the claim to make and render their decision. And then once we get that decision back, we then submit it, distribute it to the involved parties, and then the parties would then have 15 days from the receipt of the decision to comply with the ruling. There's no appeal process currently under the binding arbitration process. All decisions are final. The panels use the terms and conditions of the UIIA in regards to rendering their decisions. And like I said, as soon as we get that final decision, we'll distribute it to you, to the parties that are involved in the claim. In order to submit the binding arbitration claim on the UIA.org website, there on our homepage, there's a section towards the bottom for binding arbitration that has links to all the prior case decisions. It also has a link to the binding arbitration packet itself. And within that packet, you'll have a notice of intent to seek binding arbitration form that you would need to complete. It's basically saying you want to submit the claim and that you've initially disputed it with the provider directly in accordance with the agreement. And then there is a filing fee to submit a claim. There's a $50 filing fee and then a $250 fee if the claim goes to the panel for review. Many times when we'll get a case submitted to us from a motor carrier, when we get that case together and we'll send it to the equipment provider, when they re-review the information, there's many times that the provider will cancel the charges and then the claim doesn't have to go through the full process. And if that's the case, we'll notify the parties that, the provider has canceled the charges, and then we can remove the case from the binding arbitration process. Whoever prevails in the case, if you paid the arbitration fees, you would then be reimbursed from the party that the decision was not found in favor of. There's also a supporting documentation form that we ask for you to complete, because as part of the process, you have to identify what provision in the agreement you think the other party did not comply with in regards to the invoice that you received, and also why you believe, what your argument is in regards to why you believe the charges are not justified. As part of that supporting documentation that you provide, you would want to include copies of whatever invoices that you are disputing, in-gate and out-gate equipment interchange receipts associated or related to the interchange move, as well as email communications showing when you disputed it with the EP and when the EP responded to your initial dispute, along with any terminal screenshots, email communication with the provider directly in regards to the discussion in regards to the dispute. And then also, if it's something where you're saying that the facility did not allow, there was something precluding you from returning the equipment, if you have any type of turnaway tickets or dispatch records that show where your driver made an attempt to return it but was unable to do so, any of that type of information that you feel would be pertinent for the panel to know, you should include with your claim. And then Sherry Parnell, one of our program managers, she handles the administration of the binding arbitration claims that we receive. So once you have a claim ready to submit, you would send it to her email address, and then she would then review it and get back to you with any information that might be missing. We recently did a binding arbitration webinar just last week. So it is posted under the past webinars on the intermodal.org website. And then if you have any questions relating to the binding arbitration process or what you need to do in order to file a case, you can go to UIIA.org, and that has information regarding that, or you can simply contact our office and we'll be happy to help you in regards to any questions you may have on the process. And with that, I'm going to turn it back over to Hal.
Thank you so much, Debbie, and thank you, everybody. It's obviously a challenging time, and getting straight, hard facts is really important. The first question for you, Debbie, what happens if the BCO is closed and therefore cannot return containers? For example, automakers are shutting plants for 2 weeks. Will they incur 2 weeks of detention and demurrage if coronavirus is the reason that they shut down?
Well, the BCOs are not signatories to the UIIA. The signatories to the agreement are the steamship lines, rails, and motor carriers and equipment leasing companies. So whatever the terms are between the BCO and the providers, we would not be privy to that. So I would suggest that they contact the equipment provider directly in regards to that question.
And then there's another one that's sort of a collection of comments that is just asking for if there's a way to streamline the process during this challenging time, because there are likely going to be so many claims.
I mean, we've recently developed an actual template in the arbitration packet that is I think it's like a 2-page form that asks where you can input your basis, what provision of the agreement it is, and then just list the invoices. So we tried to make a form so that you can put all the pertinent information you need to provide us on that form. So hopefully that will expedite some of the information, but unfortunately with the supporting documentation, that is basically what you're going to provide to support your argument that you shouldn't be responsible for the charges. So we can certainly try to help you as much as we can in regards to what type of information, give you some, maybe provide some examples of what you need to provide. But, when it comes to the supporting documentation, that pretty much is up to the party submitting the claim as far as what information they want to submit.
I think this is a question for Dan, possibly Colin, but is there any waiver for the random drug and alcohol requirement?
This is Dan. I'll take that. It's not a waiver for the random process, but we are recognizing that you may not be able to complete this quarters. So the regulations require that the randoms be spread out equally throughout the year. We're not going to hold anybody accountable if they are unable to do quarterly or random testing during this particular event or this particular time. So although we want you to try, we want you to do everything you can. If your facility is unavailable, document it, record it, and then just get them made up throughout the remainder of the year.
Here's a question. Somebody's asking, just for clarification, they're coming out of Texas, but they say we can only haul intermodal for virus commodities. Our customers are still open. So I think that they just want to have some clarity on what they are and aren't able to haul. I didn't hear you, Dan or Colin, say that there are any restrictions on what can be hauled currently. Am I wrong there?
No, they can still haul whatever they want. It's just a question whether they get the relief granted in the emergency declaration, because the emergency declaration is only for the COVID-19 related supplies and materials and or stocking of the grocery stores or the other items stated in the declaration. So if they're going to be mixing during the day, that's where the problem is going to be. If they do one intermodal load and that's short trip and then they go pick up one that's not, then they're not going to want to take that for the day, because the waiver says, or emergency declaration says, you have to take a 10-hour break when you end declarated or emergency supplies and then go back to normal routine transportation.
Here's a question asking with guidance of how will trucking companies determine if they are considered essential? What's the best way for them to work through that to make their own determination?
If you go to our website, we've released the Homeland Security's information on essential. Transportation, trucking has been added to that. That's probably something that was lacking in the past. But if you go to our website, we have a link to it that defines essential employees, and truck drivers and logistics and transportation are now defined as that.
Got it. Here's a question around waivers for the initial drug testing when bringing drivers on for the first time.
Currently, we don't have that option. ODAPC, because it controls all of drug testing, which includes your pilots, they will not allow anybody to enter the industry without a pre-employment drug test. Now, the regulations do allow, under certain conditions, you can bring somebody on without one. It's very narrow. If you can use that narrow window, it's available to you. But by and large, we have no option in that. If they don't have a negative test, you can't put them on the road until they do.
Okay. And currently, is there a list of the actual essential commodities?
Yes. The declaration itself contains 8 different items that are listed. Our FAQs have clarified the intent of those 8 items. So please read our declaration. Please read the FAQs. Go to our website. It should be very clear what all is included, hopefully.
Got it. In terms of folks that need to renew their CDLs in this particular time frame, are there online options for them to do that, as opposed, because I know a lot of the state DMVs are closed for the public?
Some states have that option. I know Illinois does not. That would require massive reprogramming of their systems. Our waivers do allow those online renewals now, so we have provided relief to the states and provided some options for that. Again, our website has discusses our waiver for those that may be expiring. We're not going to take enforcement action if they cannot renew due to the state DMV being closed.
Got it. Here is a good question. I'm not sure if we're going to be able to answer it, but I'll pitch it out to the group. It's a good one. Both essential and non-essential commodities flow through ports. If warehouses using non-essential goods are not open or backed up, it could impede essential goods from getting through the ports. Are there any discussions about addressing this?
Yeah, guys, that's one of the things that's on Oliver Wyman's radar and it was brought up on a call with the Federal Reserve yesterday. One of the ports was on the advisory committee with me, and it is a serious concern that shippers who are closed are not picking up containers, and at some point that lack of evacuation of those containers is going to start impeding the port's ability to move the stuff that's staying fluid. And I think as an industry and as a nation, we need to solve that problem. But right now, I'm not aware of where the conversation is at a national level around this particular issue, and would be interested in any of the other panelists that might have any insight on that.
Hal, it's Steve here. Yeah, so it's Steve here. I will say we're working through at IANA with the American Logistics Aid Network and a number of associations having conversations on the supply chain side. And Adrian, to your point, that conversation is taking place. We're sharing those concerns and those issues. Alan has a direct line to FEMA and the White House. So those disruptions and those challenges are being forwarded. So for those of you in the field that are experiencing these challenges, please forward that information to us, because we are sharing that to make sure that key decision makers at the government level are fully aware of what's being experienced at the ground level. So keep sharing that information so we can make sure that the folks that in those levels of making decisions are aware.
Thanks, Steve. Here's one. If a driver has a negative drug test from a prior employer / contractor, but I can't get a new one with beginning a contractor with my company, are there any ways that they can make use of that previous negative drug test if they're starting with a new employer?
I don't have the regulations directly in front of me. I apologize. I can't answer that question right now. I can send you an email afterwards and let you know. Okay, that's great. Thanks, Dan. Here's one that I think I can probably handle, but I'll also ask Adrian and Steve to weigh in on, and Debbie. Has anyone heard any of the rails closing? No. I think all the rails are rolling, as it were. But we're in pretty close contact with all of the North American rails, and we have not had any updates from them on closures due to the virus. Adrian, is that kind of mirroring what you're picking up?
Yeah, other than auto, we haven't heard about any kinds of facilities or train services being shut down or territories.
Yeah. This one is sort of looking a little bit at what's happening in China. Heard a lot of positive things about their curve flattening out, their production starting to get ramped up. Is there any projection on when they might get back to normal? At least when we can expect the tap to be turned back on fully coming from China?
This is Terry. You guys may have a different view from a manufacturing and supply chain insight view, but I think they have brought things back online in Hubei province. They're planning to open things up on April 6th. Our belief is that sometime in the 2 weeks after that, we will all have a good sense as to whether or not it's actually really under control or if it starts popping back out again once you loosen constraints, kind of like what started happening when Hong Kong went from keeping it under wraps. Granted, it had little to do with production there, but I think it's a similar watch and wait before you know that everything's back online. That seems to us to be the waiting period because it'll take about that long. And if you don't see anything, that's good news, and it probably comes back on and stays on. That's from the watching the disease part, not from the supply chain part.
Right. This is Dan. Back to the pre-employment testing. I'd refer them to look at 382.301B, which gives the requirements when a pre-employment drug testing is not required. So again, that's 382.301B.
Terrific.
And then we'll give them the information they need.
Awesome. Thank you. Well, folks, I want to thank everybody so much for your time and sharing it with us, both our experts on the call and our attendees that joined us in large numbers from across the country. There's a slide up now for more information. Thank you, folks, for your time. Please stay safe, stay sane, and keep doing that great work.